An ankle sprain occurs when the ligaments that support the ankle joint are stretched or torn due to excessive twisting, rolling, or an awkward landing. It is one of the most common musculoskeletal injuries affecting athletes and non-athletes alike. The majority of ankle sprains involve damage to the lateral ligaments, particularly the anterior talofibular ligament (ATFL), which is the weakest and most commonly injured ligament in the ankle. Other ligaments, such as the calcaneofibular ligament (CFL) and the posterior talofibular ligament (PTFL), may also be involved depending on the severity of the injury. Less frequently, medial ankle sprains occur, affecting the deltoid ligament, which is stronger and more resistant to injury than the lateral ligaments. Ankle sprains typically occur during activities that involve sudden directional changes, improper landings, or uneven surfaces. Sports like basketball, soccer, football, and trail running have a high incidence of ankle sprains due to rapid pivoting and jumping movements. Everyday activities, such as stepping off a curb incorrectly or slipping on an unstable surface, can also lead to an ankle sprain. The risk of spraining an ankle increases if the muscles surrounding the joint are weak, if there is a history of previous sprains, or if improper footwear is worn. Symptoms of an ankle sprain vary based on the severity of the injury and are categorized into 3 grades. Grade 1 sprains involve mild stretching of the ligaments, with minimal swelling and discomfort, allowing individuals to bear weight with slight pain. Grade 2 sprains are moderate injuries with partial tearing of the ligament, noticeable swelling, bruising, and pain that makes walking difficult. Grade 3 sprains involve a complete tear of one or more ligaments, leading to severe swelling, extensive bruising, significant instability, and an inability to bear weight. Proper diagnosis of an ankle sprain is crucial to ensure appropriate treatment and rule out more severe injuries such as fractures. A physician will assess the range of motion, stability, and tenderness of the ankle joint. Special tests, such as the anterior drawer test and the talar tilt test, are used to evaluate ligament integrity. In some cases, X-rays are performed to rule out fractures, while MRI or ultrasound may be used if a severe ligament tear or additional soft tissue damage is suspected. Treatment for an ankle sprain follows the RICE protocol: rest, ice compression, and elevation in the initial phase to reduce swelling and pain. Rest is essential to allow healing, and weight-bearing should be limited based on pain levels. Ice application for 15-20 minutes several times a day helps control inflammation. Compression using elastic bandages or ankle braces provides stability and reduces swelling. Elevating the foot above heart level minimizes fluid accumulation. Nonsteroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen or naproxen, may be used for pain relief and inflammation control. As swelling and pain subside, rehabilitation exercises are crucial to restore mobility, strength, and proprioception. Early range of motion exercises, such as ankle circles and alphabet tracing with the foot, help prevent stiffness. Strengthening exercises, such as resistance band exercises and calf raises, rebuild muscle support around the ankle. Balance and proprioception training, including single leg dance and balance board exercises, are essential to retrain neuromuscular control and prevent recurrent sprains. Returning to sports or high-impact activities should be gradual, with bracing or taping, providing additional support if necessary. While most ankle sprains heal with conservative treatment, Improper management or repeated injuries can lead to chronic ankle instability (CAI). CAI is characterized by recurrent ankle sprains, persistent weakness, and a sensation of the ankle giving out during activity. This condition develops when the ligaments do not heal properly, leading to mechanical instability, or when neuromuscular control is impaired, making it difficult for the body to stabilize the joint during movement. Individuals with chronic ankle instability often experience frequent episodes of rolling their ankle, even during simple activities such as walking on uneven ground. There may be persistent pain, swelling, and a feeling of instability, especially during sports or high-impact movements. CAI can significantly impact an individual's ability to perform physical activities and, if left untreated, may lead to long-term complications such as ankle arthritis, peroneal tendon dysfunction, or cartilage damage. Diagnosis of CAI involves a thorough clinical examination, where a physician assesses ankle strength, range of motion, and ligament integrity. Functional tests, such as the single leg balance test and the star excursion balance test, help evaluate proprioception and stability. Imaging studies, including X-rays, MRI, or CT scans, may be used to assess ligament integrity, bone alignment, and possible cartilage damage. Treatment for CAI focuses on comprehensive rehabilitation to restore ankle function and prevent further injury. Physical therapy plays a crucial role in improving muscle strength, neuromuscular control, and joint stability. Proprioception training, which includes exercises like single-leg balance drills, wobble board training, and dynamic movement exercises, is essential to retrain the body's ability to sense and control ankle positioning. Strengthening exercises for the peroneal muscles, tibialis posterior, and intrinsic foot muscles help provide additional stability and support for the ankle joint. For individuals who continue to experience ankle instability despite rehabilitation, bracing and taping techniques can provide external support and reduce the risk of recurrent sprains. Athletes may benefit from wearing lissue, ankle braces during sports activities to prevent excessive ankle inversion or eversion. Footwear modifications, such as shoes with proper arch support and cushioning, help optimize foot mechanics and reduce strain on the ankle. In severe cases where conservative treatments fail, surgical intervention may be considered to restore ankle stability. Surgical options include ligament repair, where damaged ligaments are tightened and reinforced, or ligament reconstruction, which involves using a graft either from the patient's own tissue or a donor to replace the damaged ligament. The Brostrom procedure is a commonly performed surgery for CAI, aimed at restoring the natural stability of the ankle. In some cases, additional procedures such as osteotomies or cartilage repair may be needed if there is significant structural damage. Recovery after ankle surgery involves a gradual rehabilitation program, starting with immobilization in a cast or brace for several weeks, followed by progressive weight-bearing exercises to restore strength and mobility. Physical therapy focuses on regaining ankle range of motion, rebuilding strength, and retraining neuromuscular control to prevent future instability. The full return to sports may take several months, depending on the severity of the instability and the type of surgical procedure performed. Prevention of ankle sprains and chronic ankle instability involves strengthening proprioception training and proper footwear choices. Regular ankle strengthening exercises, such as resistance, band work, and single-leg balance training, help maintain joint stability. Athletes should incorporate dynamic warm-ups before exercise and focus on landing mechanics and agility drills to prevent excessive ankle stress. Wearing appropriate footwear, particularly for individuals with high arches or flat feet, helps optimize ankle alignment and reduces injury risk. Additionally, bracing or taping during high-risk activities can provide additional support for those with a history of ankle instability. Ankle sprains and chronic ankle instability are common, yet preventable and treatable conditions that affect individuals across all levels of activity. Proper rehabilitation following an initial ankle sprain is crucial to ensuring full recovery and preventing long-term complications. Strengthening, proprioception training, and biomechanical corrections play a key role in reducing the risk of recurrent injuries and maintaining optimal ankle health. In cases where conservative treatment is insufficient, surgical options provide an effective solution for restoring stability and function. By understanding the importance of rehabilitation, implementing preventive measures, and seeking early medical intervention when necessary, individuals can recover successfully and maintain a strong, stable, and pain-free ankle.